Hello, this is Tony Gawaldo with Arthrex Vet Systems, here with Helen Newman, the Director of Veterinary Transplant Services, a professional veterinary tissue bank. Welcome to our second podcast in a series about our partnership with the VTS and the new Biologic products we're now offering. Today we're talking with Dr. Helen Newman about Orthomix, a natural real bone allograft for animals. Welcome, Helen.
Thank you, Tony.
Helen, can you tell us a little bit about Orthomix and how it can help veterinary patients?
Sure. Orthomix is a bone graft material that veterinarians can use in their patients who have bone voids or fractures or non-unions and many other kind of orthopedic conditions. Orthomix is what we call an allograft. There are two different kinds of grafts. There's an autograft, which means taking bone graft from someplace else on the same patient and transferring it to the surgical site. That would be called autograft from the same patient. An allograft would be taking bone graft from a different patient of the same species and then using it in an animal that's having an orthopedic surgery. So as a tissue bank, what we provide are allografts. Orthomix is an example of an allograft. So we have canine Orthomix, and it can be used in canine patients. That's an example of allograft. So Orthomix, the reason we call it Orthomix is because it's a mixture of cancellous bone chips and demineralized bone powder. Pretty much everybody's familiar with cancellous bone chips. That's what you get when you're taking an autograft. You're going to, say, the proximal humerus and scooping some bone from there to put into your femur fracture, for example. You're basically getting cancellous bone. But Orthomix is a mixture of cancellous bone and a key component called demineralized bone powder. Demineralized bone powder is a special part of this graft in that we in our processing have removed the minerals. And by removing the minerals, what that's done is expose the intrinsic growth factors that are hidden in the bone matrix. And what this does is it allows those growth factors to be exposed from the moment that you put this graft into the site. So Orthomix is a mixture of cancellous bone chips and demineralized bone powder that bring from an animal of the same species into your patient graft material that has a great scaffold, but is also osteoinductive in that it has got those growth factors to stimulate bone formation from the moment you put it in place.
So if you have your choice between an autograft and an allograft, why use Orthomix if an autograft works just as well?
Well, there are a number of reasons why people would choose to use an allograft or choose to use an autograft. Now, autografts are great, and they come with living cells. Pretty much the most important cells that come in an autograft are those bone marrow lining cells that line all the surfaces of the cancellous bone, because that's where the population of progenitor cells comes from. So those are the cells that you're transferring. Those are the important cells that are going to go to create bone when you're using an autograft. When you're using an allograft, like Orthomix, you have the growth factors exposed, like I said, plus you have the scaffold. And so you don't have the living cells, but you're putting this graft into a location normally where there are living cells going to have access to the graft materials, and they will respond to those growth factors. So some surgeons will just use autograft alone, but many don't want to take the extra time and effort or even compromise a patient who might be, say, an osteopenic patient or an anesthetic risk patient or an older patient where they might have to spend extra time or risk of getting autograft. They can just use allograft. But there are quite a few studies that show that there's no difference between allograft and autograft in long-term healing. So although maybe you get a little faster healing with autograft in the first week or so, there's no difference in the literature between allograft and autograft in long-term bone healing. So many surgeons have just decided to not bother with the autograft. They're putting allograft in a vascular site. It's got the growth factors exposed. And so that's why the convenience of being able to open up a package and have all the graft you need is an important part in moving through a surgery. So those are the main reasons that people would use Orthomix. It works as well as autograft in long-term healing. It's readily available. It also can be used to augment what you get for autograft. You know, if you don't get enough from one site and you have to flip that animal over to go to a second site, you maybe ought to consider using the allograft as just an extender. So there are a lot of ways that allograft is appropriate for use. Directly can be used to augment autograft. It's very versatile. A few other advantages to consider when thinking about using an allograft is that particle size is optimized for osteoinductivity. A couple of other points about why and what advantages an allograft brings. Number one is the particle size is optimized for osteoinductivity. There are quite a number of studies that show an optimal particle size for cells to respond and lay down new bone. And our bone is milled and sieved to those particle sizes. These are a lot smaller than what you would get when going to retrieve an autograft, for one. And the advantage of having this small particle size is the large surface area that you get for exposure of the growth factors. The other thing is that the exposure of the growth factors is immediate, rather than having to resorb some mineral of the autograft before growth factors are exposed. And so, one of the great advantages is the mixture of allograft and autograft to augment the extra growth factors with the extra growth factors of demineralized bone powder with your autograft.
Can Orthomix also be combined with other biologic products?
Absolutely. Allograft can be combined with biologics. These can serve to enhance the effectiveness of the graft material. There's really no downside to augmenting bone graft with any additional kinds of biologic materials, growth factors, cells, or even antibiotics. Many times people will ask if they can add antibiotics to bone graft, and absolutely they can. There are quite a number of studies that show that bone graft materials will adsorb antibiotics and then slowly release them into the site over time. And so one could preload allograft with antibiotic of choice and then use that allograft in an infected site and expect to be able to elute antibiotics locally. So there's a number of studies available to show that, and I'd be happy to discuss that in more detail with anybody who's interested.
So is Orthomix a species-specific allograft, or can it be used on different species?
That's a great question, and we get that all the time. It's intended to be species-specific. We make a canine version, we make a feline version, we even make an equine version. But because the allograft is processed to remove all of the cellular elements, and there really isn't any immunogenic response from the recipient to the graft materials, many veterinarians will use our canine bone grafts in all of their patients. And in fact, there are quite a lot of zoo patients, for example, harbor seals and bobcats and hyenas and porcupines who have canine bone allograft implanted and successfully healing. So technically they're created for species specificity. There's canine versions, feline versions, and some people just only want to use feline in feline patients, and some people only want to use canine in canine patients. But suffice it to say, there have been so many felines that have canine bone graft in them because that was the only graft available, at the time of surgery, for example, and the surgeon was forced to use the allograft from a different species. There haven't been any reported problems to date, and in fact, follow-ups have shown they've successfully healed.
So it comes in different sizes. So is somebody going to look for a particular size for a smaller toy breed dog or even a cat versus a dog or even a horse?
Sure, that's a good question as well. We make a number of different kinds of Orthomix, and the difference is purely only in the particle size. So we have what we call a fine mix, and then we have one that's even smaller particle size called ultrafine. And ultrafine is often a graft of choice for feline patients because they have much smaller spaces usually to, bone voids to fill. It's also great in canines for arthrodesis and other kinds of procedures. I'd say, I guess, that ultrafine is the most universally applicable particle size. It's 125 to 710 microns. The Orthomix fine, larger particle size. If you've got a really big void or a large osteotomy you're trying to fill, the larger particle sizes are sometimes easier to use in the Orthomix fine. We try to have graft material available for all indications.
So it really depends on the size of the defect that you're trying to fill versus the size of the animal the procedure is being done on.
Exactly.
So what is the handling properties of the Orthomix? Is it a putty? Is it pliable?
Well, the Orthomix is our most commonly used product, and it's a particulate. It's like dry sand in a way. It comes to you freeze-dried, although we also have frozen versions, but the most commonly used is a freeze-dried version. It has a 5-year shelf life. It can be rehydrated right inside the syringe. If you have a 1 cc of bone graft, you add a 1 cc of sterile saline or patient blood. Just shake it together or mix it together for about 30 seconds and you can apply it directly to the site. So some people will put the freeze-dried bone graft directly into the site. That's okay too. It'll rehydrate, in situ. But I like to recommend that people rehydrate it with patient blood for 2 reasons. Number 1, blood is going to add all of the beginning growth factors that are needed to help jumpstart the healing process. And number 2, it starts to form a clot. And so it kind of helps to hold the particles together and makes it a little bit easier to use a spatula or an elevator to apply the allograft to the site where you need it. So it helps to cohese the particles together. I'd also like to add that it comes in a range of dose sizes. So the ultrafine, which is intended for smaller voids, comes in 0.5 cc and 1 cc doses, both canine and feline. And then the Orthomix Fine comes in 1, 2, and 3 cc doses.
Okay. Thanks again to Dr. Helen Newman for spending her time with us today and especially for sharing her expertise in the Arthrex goal of helping surgeons treat their patients better. If you're a veterinarian interested in learning more, please get in touch with us via email at csvs@arthrex.com or call our customer service department at 1-888-215-3740. If you're interested in more technical questions, feel free to call Dr. Newman directly at VTS, telephone number 253-520-0771. In our next podcast, we'll be discussing Fusion Express, an injectable bone putty for animals. Thanks to everybody for listening.